here I would like to use this case to illustrate the principles of examination of the joint or the musculoskeletal system. The three primary objectives that we want to achieve when examining the joint. First of all, we want to know what is the diagnosis. Secondly, we want to know whether the patient's arthritis is currently active. And thirdly, whether the arthritis has caused any dysfunction in the physical function of the patient's joint. As with all other examination, you remember different headings. We have inspection, palpation, percussion, and auscultation. For musculoskeletal system or examination of the joint, we also have 4 headings. We have also inspection. We also palpate the patient's joint, but instead of percussion and auscultation, we will test the joint's range of movement as well as the joint function. So let's take a look at this patient's hands. This patient has got rheumatoid arthritis, and I would like to use examination of her hands to illustrate the various principles that I have just highlighted. So we proceed to examine the patient's hands. I would first of all like to ask the patient to put her hands on the lap. 可以擺隻手喺個大髀度啦，好冇? So when I looked at the hands, I want to note how many joints are affected by the disease and which joints are affected and whether there is any deformities or swelling or changes in the size of the joint. As you can see that this patient has got some degree of arthritis involving both the wrists and multiple metacarpophalangeal joints on both sides, and some of the proximal interphalangeal joints on both sides. And in addition, there is swelling of the metacarpophalangeal joints with some ulnar deviation of the metacarpophalangeal joint on the right side. Further, we also note that this patient has got rather marked small muscle dystrophy, suggesting to us that this patient has got the arthritis for some time. So noting all these features, one could say in this patient that she has got a chronic arthritis that affects multiple joint polyarthritis, that is bilateral involving both hands, and symmetrical with both wrists, both sets of MCP joints, and both sets of PIP joints being involved. And that there is swelling and joint deformities. So my provisional diagnosis is that this patient has got chronic rheumatoid arthritis. After inspection, we will proceed to palpate the patient's joints. Okay. There are 3 reasons for palpating the patient's joint. First of all, we want to note whether there is any increase in temperature, which might suggest some degree of inflammation. Secondly, we want to note whether the joint is tender or not. Thirdly, whether the joint is swollen, and if it is swollen, whether it is soft tissue swelling or whether it is bony swelling. So we will proceed with this. To start with, lighter palpation to test the temperature of the joint. So comparing the 2 sides as well as comparing the temperature with the adjacent structure. Okay. Noting the patient's face all the time, whether I am causing her any discomfort. 我而家檢查你嘅手，好嗎? And then I would like to examine each of the joint for swelling and tenderness. So we will start with palpating the wrist joint. It is useful to gently move the patient's wrist and at the same time note the patient's face whether I am causing her any pain or distress. We will then palpate the wrist joint to see if it is tender. 如果有痛話俾我聽喎。係。有嘛？少少。Okay. Making sure that you palpate the whole wrist joint. 痛啊？少少係嘛？ Okay. And at the same time, note whether there is any swelling. This patient does have a slight degree of synovial swelling on palpation. We will then proceed to palpate the other small joints of the hands and using 4 fingers so that we will palpate all 4 sides of a joint. Starting with the metacarpophalangeal joint, 有冇痛啊？少少係咪？ The first, the second 有痛係咪？ Third 有係咪？跟住咧？少少。Okay. So after the metacarpophalangeal joints, we will test the interphalangeal joint. So this is the first interphalangeal joint. 有冇痛啊？ And then the proximal interphalangeal joints of the other fingers. And then the distal interphalangeal joint. Okay. And then we will proceed to examine the other hand as well. After the examination, we should note which joints are tender and which joints are swollen, and if there is swelling, what type of swelling. So in the right hand, we note that the wrist, the 2nd, 3rd, 4th, and 5th metacarpophalangeal joint, as well as the 3rd, 4th, and the 5th proximal interphalangeal joints were both tender and swollen. And when I palpated, the swelling appears to be soft tissue, suggesting that it is a form of synovial swelling. So we proceed to test the function of the patient's hands. One of the important things about the function is that the patient must have good hand grip. So I would like to test the hand grip now. 你可唔可以攞隻手咧揸實我2隻手指，有咁大力得咁大力 ？Okay. To find out whether the grip strength is normal or not. Okay. 放翻開啦而家。And then we would like to test whether the thumb opposition or the pincer grip is normal. 你攞隻手咧整個圈咁嘅樣，我又整個圈擠落嚟呢度咧，你就唔好俾我拉開佢喎。Okay. The pincer grip is good. 我有手指公同手指尾得唔得？ She has some difficulty with the right side, but on the left side it is weaker than mine. 手指公同個手指尾。So she has difficulty opposing the thumb and the pinky on the right side. So we won't be able to test this. And she is able to oppose the thumb and the pinky on the left side and with a poorer grip. This patient has got rheumatoid arthritis and has been complaining of pain in her knees. So on examination of the knee joints, we would like to find out whether the arthritis is active in these 2 joints. Okay. So on inspection of the patient, not only do we take note of what changes there are in the knee joint, but also the adjacent structures. One of the most important signs that we pick up here is that this patient has got bilateral quadricep muscle wasting. What does it tell us? It tells us that this patient must have had knee arthritis for some time with disused muscular dystrophy. When we look at the knee joint, we should note whether there is any discoloration. Active inflammatory arthritis may sometimes cause a red discoloration of the joint. We should take note of the size of the knee joint to see whether it is increased or not. You note that the left knee is bigger than the right one. Okay. We should also take note whether the knee has got any deformities such as valgus or varus deformities. Okay. So after inspection, what we want to do is to palpate the knee joint. Primarily, first of all, to find out whether there is any increase in temperature between the 2 knee joints, as well as between the knee joint and the adjacent structures. Okay, so this patient has got a warm left knee. Palpation will also help to determine whether the swelling of the knee joint is due to either fluid accumulation, synovial thickening, or perhaps bony swelling. Okay? There are different ways to detect whether the knee joint has got fluid accumulation. Okay? The first thing to do is to find out whether there is any movement of the knee joint. For example, with the right knee, what we do is, if there is an effusion, what we do is we will try to milk all the fluid from one side, in this case the medial aspect of the knee joint, to the other side of the knee joint. We stop the fluid from returning through this way, and then we run our hand down this way, and if there is fluid accumulation, you will see a bulging of the knee joint over this aspect. This patient does not have a positive bulge sign, so there isn't a great deal of detectable knee joint synovial fluid. The other possible way of detecting knee joint fluid is to see if we can actually feel the fluid movement. Again, very similar to what I've just shown earlier on. You want to milk all the fluid from one end to the other, and this time from the upper end to the lower part of the knee joint. And then what you do is you then stop the fluid here using your left hand, and you use your two fingers to gently squeeze on the knee joint. And if there is fluid accumulation, you will feel fluid hitting the border of your finger and your thumb of the left hand. So this patient does not have much of the fluid in this knee joint either. So the next possibility is that this knee joint is swollen because of synovial thickening. Following palpation, what we want to do is to test the range of movement of the joint. When examining the movement of the joint, it is important that we place one hand on the patient's patella. Okay? The reason for this is to use this hand to feel actually what happens to the knee joint as you move it. So 我而家同你喐下隻腳咯喎，okay? So we will flex, extend the knee joint, and in the process, I use my hand to feel whether there is any crepitations inside the knee joint. Okay? Crepitations might be soft or may be coarse. Soft crepitation might suggest some synovial swelling or thickening within the joint. Coarse crepitation might suggest perhaps cartilage damage or a form of degeneration of the joint. So we will move the knee joint, testing the flexion and extension of the knee joint. And you note that at the same time, I'm also flexing the patient's hip joint. So in a way, we are testing also the range of movement of the hip. It is also useful to then externally rotate and internally rotate the hip joint to detect whether there is any pain coming from the hip. 個 hip 唔痛㗎，痛唔痛啊？ Okay. The reason being, sometimes knee joint pain might be referred pain from hip arthritis. Okay. So we will do this with both knees, and you can see that the patient has got some pain, and I'm not quite able to fully flex the knee joint. Okay, extension is okay, and then external rotation of the hip, 痛唔痛啊？ Internal rotation, 唔痛. And in the process, I can actually feel both soft and coarse crepitations in this knee joint, suggesting that perhaps partly the swelling of the knee joint is due to synovial thickening, and partly there is some secondary degeneration of the knee joint. Besides the joint, what we really want to note is whether there's any ligamentous lesions of the knee that causes the patient's pain. Okay? 你個膝頭哥痛唔痛啊？我哋用個右邊少少。
哦，
好冇？
而家就我食咗止痛藥冇咁痛啊，今朝好痛。
Okay.
日日都痛。
So we have the medial collateral ligament and the lateral collateral ligament. Okay. So to detect whether there's any damage to the medial collateral ligament, what we want to do is to forcefully abduct the knee joint. Okay, I won't do it too hard because this patient has got rheumatoid arthritis. And then ask the patient to tell me, 我而家咁樣整你痛唔痛啊？
唔痛。
Any pain on the medial aspect of the knee joint. To test the lateral collateral ligament, so we will do the opposite, stretching the lateral collateral ligament to see if there is any pain. Besides the medial and the lateral collateral ligaments, there are also two very important ligaments in the knee joint, the cruciate ligaments. Probably it's not so relevant in our patient, but in someone who, say, for example, has just participated in sports and complains now of very severe knee pain, it is important to detect whether the cruciate ligaments have been injured or damaged. Okay. To do this, you will have the patient's knee at 90 degrees, and then you will gently, to start with, pull the tibia outward towards me. Okay. Here I'm actually testing the function of the anterior cruciate ligament, and if it is damaged or injured, there will be pain as I pull the patient's tibia towards me. To test the posterior cruciate ligament, we will do the opposite, pushing the tibia downward or inward. And if there is pain, it might suggest that there is possible damage or injury to the posterior cruciate ligament. So this ends the examination of the knee joint. Now I would like to demonstrate examination of the spine. When examining the spine, we note first inspection, palpation, and then the range of movement. When inspecting the spine, we would first of all like to look at the spine from the side. 或者你打側身。So you note whether there's any abnormal deformity of the spine, and we note that this patient has got a slight stooped posture of the spine. And then we will look at the posterior aspect of the patient's spine. We then proceed to examine the spine from the back. We would first of all like to note whether there is any symmetry of the back, whether the shoulder level is equal on both sides, and whether there is any obvious paraspinal contraction or spasm. We will proceed also now to palpating the spine. As you know, the first bony prominence that we are able to palpate is the 7th cervical spine spinous process. And if we then move down and trace the spinous process of the lower part of the spine, the thoracic spine, and then the lumbar spine, we will be able to detect whether there is any deviation of the spine, as in the case of a patient with scoliosis. Note that this patient's spine does not deviate at all. Then we proceed to find out whether there is any tenderness involving the spinous processes. 如果我整到你痛，你話俾我聽喎，脊椎 OK。Noting the patient's face while moving your fingers down the patient's spine. In addition, I also generally would lightly tap on the spine to elicit any tenderness that might suggest a positive pathology. 又係我慢慢敲係個腰椎，如果有痛嘅話，話俾我聽。好。冇。OK， 好，唔該。Then next, we would like to find out whether the paraspinal muscles are tense that might suggest muscle spasm. Okay, so we will palpate the paraspinal muscle 冇痛啊？
冇。
For contraction, spasm, as well as tenderness. Next, we would like to test the range of movement of the spine. There are different movements at different parts of the spine. For example, the lumbar spine will allow flexion and extension movement. To test the patient's flexion movement, we would like to ask the patient to bend down and try to use her hands to touch the floor. 曾先生，請你或者向前彎腰，咁樣攞隻手盡量低嚟到掂個地下。可以再做多一次添啊！再嚟。We then note the distance of the finger. And for this gentleman, the finger to floor distance is 32 centimeters. A more accurate way of detecting lumbar spine flexion is to perform this so-called Schober's test. 我可唔可以將條褲拉低啲咁多？好冇？ With the Schober's test, we need to first identify our landmark, which is the posterior, superior iliac spine on both sides. Having defined this, we will mark somewhere in the middle, and then from there we will draw a line which is 10 centimeters above that point. And we will then ask the patient to bend forward again, 或者曾生向前就係彎腰。And then note the level, the degree of extension of this line. Here we see it has gone from 10 to 15 centimeters. 唔該。Which suggests the lumbar spine flexion range is normal. The other range of movement of the lumbar spine is lateral flexion. So 曾先生可唔可以轉一轉身向住嗰邊啊？可以。好嘛？你直情成個人轉身。OK。And then 我而家就想請你咧攞個手指咧喺個側邊度掂個膝頭哥側邊得唔得啊 ？OK。另外嗰邊呢？另外嗰邊 ，OK， 係咁多 ，OK。OK， 嗱，你攞個手打側掂個膝頭哥側邊，另外嗰邊 ，OK。So you will note that this patient has got limited lateral flexion movement on the left side. So from the lumbar spine, we move up to the thoracic spine. With the thoracic spine, there are two measurements that we should note. First of all is the chest expansion. 我會喺度你 OK 嗱，你嘗試咧唞一啖大氣。然後呼晒，而家再唞一啖大氣，然後呼晒。Another movement of the thoracic spine is rotation. When testing thoracic spine rotation, you do not ask the patient to turn his back if the patient is standing up, because now, as you can see, when I'm doing it, not only am I rotating my thoracic spine, but also my pelvis. So the important thing to do is to have the patient's pelvis fixed, for example, by sitting the patient on the edge of a bed. And then you ask the patient to turn her back to the two sides. 曾先生，你試下成個身轉過嚟，右手邊 ，OK， 然後跟住另外嗰邊。有咁盡得咁盡 ，OK。Then we proceed to examine the range of movement of the patient's cervical spine, which includes both lateral flexion, extension, and rotation. 曾先生請你試下攞個下巴掂個心口，彎耷低個頭，係啦。OK， 然後跟住向上望，向天望，有咁高望咁高。Okay, so he does have some limitation in the flexion and extension of the cervical spine. 而家請你擰轉頭望我呢邊個膊頭。So the rotation to the right 呢一邊，左邊。Rotation to the left。然後跟住咧，嘗試攞個耳仔，好似我咁掂個膊頭，好冇？Lateral flexion on the right, lateral flexion 左邊。In fact, all appear to be rather limited. In some patients who are suspected to have spondyloarthritis, you want to test whether there is any sacroiliac joint tenderness. To do this, you do not want to have the patient standing up because when you palpate on the sacroiliac joint, you will be pushing the patient forward. So what you do is to have the patient sit down on the edge of the bed, and then you put your thumbs on the sacroiliac joints and ask, 有冇痛啊? If there is any tenderness. Having directly palpated the sacroiliac joints to find out if they are tender, one could also elicit sacroiliitis or sacroiliac joint tenderness using the following maneuver. First of all, it's called pelvic springing. What you do is to apply a downward force onto the patient's pelvis, push down, and then you note whether there is any pain or tenderness in the patient's lower back. 曾先生，我會向下咁樣撳你個盤骨，如果整到你痛，你話俾我聽，好嘛？輕輕力，痛唔痛啊？唔痛。Okay, to start with a gentle one, and then a bigger push. 痛唔痛啊？OK， 唔該。